After performing the overhead squat assessment, I noticed a few dysfunctions in my squat. Anteriorly, my left foot moved outward. Laterally, my low back arched on both sides. And posteriorly, there was an asymmetrical weight shift towards the left. For the corrective exercise continuum, we're going to be primarily focused on the asymmetrical weight shift because this is the primary dysfunction, and focusing on this dysfunction in particular will help alleviate the other dysfunctions that were seen in the overhead squat assessment. So we are going to start with inhibitory techniques, and inhibitory techniques decrease the overactivity in neuromyofascial tissues. We are going to perform it with self-myofascial release with foam rolling, and we're going to foam roll an overactive muscle. I have chosen the quadricep, particularly the quadricep on the same side of the shift as the overactive muscle, and we're going to foam roll it so we can decrease the overactivity and release trigger points in the quadricep of the same side of the shift. So in my case, it is the left leg. So I'm going to be using this foam roller when I'm fold rolling my quadricep. And to foam roll, we're going to make sure that we're properly aligned, and we're going to use our extremities, so we're going to use our arms to make sure that we are getting the desired amount of pressure and weight on the quadricep so we can allow for good, proper tension release. Once we're finally in position, we're going to use the joint in maneuver to slowly move across the quadricep. Once we hit a trigger point, we're going to hold the foam roll in position that we're in and use our breathing and make sure that we're relaxed. We're going to hold it there for about 30 to 90 seconds, and then after that time is up, we're going to slowly move away from that point and move to another trigger point in the quadricep muscle. So here I am properly aligned on my left quadricep. I'm going to slowly move, and here's the trigger point right here. I'm going to hold, breathe for 30 to 90 seconds. And then after that time is up, slowly move away until you find another trigger point, which I have another one right here. And again, repeat the process until you're finished with the whole quadricep. So now we're going to move on to lengthening techniques. And lengthening techniques basically elongate shortened muscle tissues and connective tissues to increase range of motion at a joint. We are going to use static stretching for the overactive quadricep muscle on the left side, and static stretching is slow and constant. We're going to perform a quadricep stretch for 4 sets, 30 seconds on each set, so we can elongate the shortened muscle tissue. To stretch the quadricep, we're going to have our right leg straight. We are going to have the rest of our body straight. We can have our arms for support, and we are going to flex the knee all the way till we can touch the hamstring as much. And we're going to hold it for about 30 seconds. And you should feel a stretch in the quadricep. And then afterwards, release. Take a 15-second break and then continue on to the next set. And we're going to continue this for 4 sets in total, each consisting of 30 seconds stretch. So after inhibitory and lengthening techniques of an overactive muscle, we are now going to activate an underactive muscle. With the asymmetrical weight shift, we are going to activate the glute medius and glute maximus. And to do this, we're going to use isolated strengthening. Isolated strengthening enhances motor unit activation, firing rate, and synchronization. So we're going to use isolated strengthening to activate the glute max, and we're going to do this with clamshells with a resistance band. We're going to start in this position to do the clamshells with the resistance band. Our knees are flexed, we are flat on the ground. So we're properly aligned, and now we're going to abduct the leg, keeping our knees flexed in the same position. We're going to hold it at 2 seconds and then slowly come back down. Again. And come back down. And we're going to do this 15 times, 2 sets. Now we're at the end of the corrective exercise continuum, so we have to do an integration technique. Integration techniques incorporates the entire human movement system in order to perform a functional and controlled movement. I have decided to do dumbbell step-ups as our integration technique because we're incorporating so many muscles with dumbbell step-ups, including the inhibitory and lengthened quadriceps. We are using our glute medius and glute maximus that we activated. We're also using the hamstrings, the gastrocnemius, the soleus, the trapezius. We're using our obliques, abdominis rectus, levator scapula. So we're using so many muscles to perform this movement. So we are allowing ourselves to use all of our muscles in our body to perform a movement, and hopefully it is much more controlled and properly done since we have completed the entire corrective exercise continuum. So for the integration technique, we're going to do dumbbells, 3 sets, 10 repetitions per set, and we're going to demonstrate. So basically, we want to keep our ankle dorsiflexed. We're going to go up on the step. We're going to flex our knee, our hip, and come up. Then come back down. Up. Down. Now we are going to reassess using the overhead squat assessment again. The second time around, I felt a lot looser compared to the first time. Visually, I noticed the same dysfunctions aforementioned, however, they have been reduced.